So it's been a very nice time trying to make a lot of introductory videos on orthopedics. So I'm moving on, uh, still talking about all those terminologies, and how they could actually be applied in orthopedics. So what we're moving next is to talk about periarticular erosions. All right. So when you are hit with a word like this, always try to make sense out of it. When you say something is peri, simply mean that thing is around. Erosion is erosion, right? Articular is two things coming together. So two things coming together in the body, of course, you are basically talking about what? Your joints, So periarticular erosion just simply means there's issues around the joint, okay? And the joints are kind of like wearing up. That's like the bones around that form the joints. So periarticular erosions, we see that they are a hallmark radiographic finding in several inflammatory arthritis, most notably, okay? They help you to know that this person definitely has issues of rheumatoid arthritis, then that they also help in also diagnosing all those erosive, osteoarthritis. So what are periarticular arthritis? They are just localized areas of bone resorption, okay, adjacent to joints. They are typically seen on x-rays. Very nice. Okay, Romanus sign, Anderson sign. We'll talk about them very well when we start talking about imagings. Causes, they are there because there have been inflammations, and the inflammation has gone on for a very long time. So location is often at the bare areas of joints that are not covered by cartilage, okay, making them vulnerable to Pannus invasion. Okay. So common conditions that could actually cause all these erosive periarticular erosions: rheumatoid arthritis, erosive osteoarthritis, psoriatic arthritis, gout, septic arthritis. All right. So you can pause and look at the type of erosion pattern, the joints that are mostly affect. MCP is the metacarpophalangeal, okay, then the PIP, then the MTP. So pathophysiology is just trying to look at how the erosions come around, how new bone formation, inflammation is what actually gets to form all of that. Okay, so what are the clinical importance? Okay, so it helps to differentiate what inflammatory arthritis from the degenerative arthritis. Okay, and prognostic indicator. Okay, so if I see this in a patient, of course I know that the disease condition has been there for a very long time. So of course, when I'm trying to treat such a patient, the treatment modalities I will put in will be aggressive. You understand all those kind of things. So I think that's how we go about this.